Welcome. Today we're delving into a complex and widespread condition affecting millions worldwide: chronic kidney disease, or CKD. CKD isn't just one disease, but rather a gradual loss of kidney function over time. Our kidneys are vital organs, responsible for filtering waste and excess fluids from our blood, which are then excreted in urine. They also help regulate blood pressure, electrolyte balance, and red blood cell production. When kidney function declines, waste builds up in the body, leading to a cascade of health problems. Join us as we explore the causes, symptoms, diagnosis, and management of this serious condition. So, what causes this progressive decline in kidney function? The two leading causes of CKD are diabetes and high blood pressure. Over time, high blood sugar levels can damage the tiny filtering units in the kidneys called glomeruli. Similarly, uncontrolled high blood pressure can damage blood vessels in the kidneys, hindering their ability to filter waste effectively. Other less common causes include glomerulonephritis, which is inflammation of the kidney's filtering units, polycystic kidney disease, a genetic disorder that causes cysts to grow in the kidneys, prolonged obstruction of the urinary tract from conditions like kidney stones or an enlarged prostate, recurrent kidney infections, and certain medications and toxins. Sometimes the cause of CKD remains unknown. Let's understand what happens in the body as CKD progresses. As the kidneys are damaged, their ability to filter waste products like creatinine and urea diminishes. These toxins accumulate in the blood, leading to a condition called uremia. The kidneys also produce important hormones, including erythropoietin, which stimulates red blood cell production. With CKD, erythropoietin production declines, leading to anemia. Damaged kidneys also struggle to regulate blood pressure, often contributing to hypertension. Furthermore, they fail to maintain proper electrolyte balance, particularly calcium, phosphorus, and potassium. This imbalance can weaken bones, disrupt heart rhythm, and cause other serious complications. In essence, the gradual decline in kidney function affects numerous bodily systems, creating a complex and challenging clinical picture. Chronic kidney disease is a significant public health concern, affecting millions globally. Its prevalence increases with age. According to statistics, approximately 1 in 7 adults in the United States has CKD. Certain populations are at higher risk, including individuals with diabetes, hypertension, a family history of kidney disease, and those of African American, Hispanic, Asian, or Native American descent. The rising rates of diabetes and hypertension are contributing to the increasing prevalence of CKD worldwide, making it a critical area of focus for healthcare professionals and researchers. Unfortunately, CKD often progresses silently in its early stages. Many people don't experience noticeable symptoms until their kidney function is significantly impaired. When symptoms do appear, they can be vague and easily attributed to other conditions. Some common signs and symptoms include fatigue, swelling in the ankles and feet, nausea, loss of appetite, changes in urination frequency, especially at night, persistent itching, muscle cramps, difficulty sleeping, and shortness of breath. As the disease progresses, more severe symptoms like chest pain, seizures, and confusion may develop. It's crucial to be aware of these potential warning signs, especially if you have risk factors for CKD. Diagnosing CKD typically involves a combination of blood and urine tests. A blood test measures the levels of creatinine, a waste product normally filtered by the kidneys. From this creatinine level, doctors can estimate the glomerular filtration rate, or GFR, which indicates how well the kidneys are filtering. A GFR below 60 milliliters for 3 months or longer suggests CKD. Urine tests, such as a urine albumin to creatinine ratio, help detect protein in the urine, which can be an early sign of kidney damage. Imaging tests, such as ultrasound or CT scans, may be used to visualize the kidneys and identify any structural abnormalities. In some cases, a kidney biopsy, which involves taking a small tissue sample for examination, may be necessary to determine the underlying cause of CKD. CKD is classified into 5 stages based on the glomerular filtration rate GFR. Stage 1 indicates mild kidney damage with a normal or high GFR 90 or greater. Stage 2 signifies mild kidney damage with a GFR between 60 and 89. Stage 3 is further divided into 3FR 45, 59, and 3B a GFR 34, representing moderate kidney damage. Stage 4 indicates severe kidney damage with a GFR between 15 and 29. Finally, Stage 5 is kidney failure, also known as end-stage renal disease (ESRD), with a GFR less than 15. This staging system helps doctors determine the severity of the disease and guide treatment decisions. The specific types of CKD are often categorized by the underlying cause, such as diabetic nephropathy, hypertensive nephrosclerosis, or glomerulonephritis. The primary goals of CKD treatment are to slow the progression of kidney damage and manage associated complications. This often involves lifestyle modifications, such as adopting a kidney-friendly diet that limits sodium, potassium, and phosphorus intake, maintaining a healthy weight, Quitting smoking and limiting alcohol consumption. Medications play a crucial role in managing blood pressure, blood sugar, and cholesterol levels. Anemia is often treated with erythropoiesis, stimulating agents, ESAs, or iron supplements. Phosphate binders can help control phosphorus levels. As CKD progresses to kidney failure, dialysis or kidney transplantation becomes necessary. Dialysis is a process that filters waste and excess fluids from the blood when the kidneys can no longer do so. Kidney transplantation involves surgically replacing a diseased kidney with a healthy one from a donor. While CKD isn't always preventable, there are several steps you can take to reduce your risk. The most important strategies include managing diabetes and high blood pressure effectively, maintaining a healthy weight, eating a balanced diet, staying physically active, avoiding smoking, and limiting over-the-counter pain medications like NSAIDs, which can damage the kidneys with prolonged use. Regular check-ups with your doctor, especially if you have risk factors for CKD, are essential for early detection and intervention. The prognosis of CKD varies depending on the stage of the disease, the underlying cause, and the presence of other health conditions. Early detection and management can significantly slow the progression of kidney damage and improve overall outcomes. However, CKD can increase the risk of cardiovascular disease, bone disease, and other complications. Recent research is focused on developing new therapies to protect the kidneys and prevent disease progression. This includes investigating novel medications that target specific pathways involved in kidney damage, as well as exploring regenerative medicine approaches to repair damaged kidney tissue. Advances in dialysis technology and immunosuppressant medications are also improving the quality of life for patients with end-stage renal disease. The future of CKD management's promise for earlier diagnosis, more effective treatments, and ultimately, better outcomes for those living with this chronic condition.